The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of breast surgery. With us, we have an expert on the topic, board-certified plastic surgeon, Dr. Corbin. Dr. Corbin, welcome to the program.
Thank you.
All right, now you have a big practice, I guess, in LA.
Yes.
And thanks, and we've been trying to get you on this show for a couple of months, so thanks for coming down. Now, before we get into today's topic, and we're talking about breast today, but you do just about everything in your practice?
Yes.
Is that correct? I mean, who's the typical patient you see?
My typical patient can be a man, can be a woman, can be a child, or it can be a transgender individual who is unhappy with one or more aspects of their appearance.
So you do facelifts?
Yes.
Nasal surgery?
Yes.
You do fillers and Botox and all of those things?
All of those. And we have, a website, Nose Expert, and for men, gynecomastia expert.
You have several websites?
Yes.
And thebreastexpert.com. And by the way, people just tuning in, we're talking about breast today, what you need to know. Very unusual site. And I say unusual because I look at websites, I interview doctors all over the country, and yours is it's about beauty and it's about self-esteem, and it's like makeover after makeover after makeover. I mean, you feature these patients.
Well, what we do is take your average patient and essentially convert them into Playboy models.
Because they all look like models, by the way, on the site.
Yes, so and they're all ages, too. I mean, if you look at the website, you'll see there are young girls there that people would associate with Playboy, some of whom actually are playmates. And there are housewives and mothers.
And you have a celebrity clientele as well.
Of course.
A following.
Yes.
Now, how long have you been in LA, by the way?
Oh, God. I completed training in 1979 and came out to LA in 1980.
Okay, good. Now, your background in training, tell me a little bit about your training.
I'd love to. Basically, what a lot of people don't understand is it's a long road to become a plastic surgeon. So basically, I have 10 years of training, 2 of which was in the military as a major during the Vietnam conflict. But I initially started out as an intern at UCSD, completed my general surgery training at Tufts University, my plastic surgery training, as well as a fellowship in hand surgery at Columbia University, right. And then also have 2 years in the military in between there.
Okay. Now, you do a lot of volunteer work.
Yes, I do, and I get a lot of pleasure. Yes. Matter of fact, that's, I think, what I'm most proud of.
You told me on the phone, you said, Randy, if I could do that full time, I would do that. I mean,
I absolutely would.
Because of the changes in their lives?
Yes, and because it makes you feel even better about yourself because you're going somewhere where they do not have, the teams of people to correct these problems, and you just feel good. I mean,
do you do it once a year? You do it at least?
Yeah, I try to do it at least once a year.
Is there a connection? That means the results you get in another country fixing somebody's face or problem with what you're doing today in your practice?
Oh, absolutely.
And what is it? What is it?
Basically, it's we're improving the self-esteem of those individuals in the third world countries, as well as the self-esteem of people in the United States.
Okay, now moving on to breast surgery, and what people need to know. Who's the typical patient, and what are the age ranges now that you see? And is it the number one procedure? I mean,
well, actually, I think it is the number one procedure in plastic surgery. In my practice, though, your average patient is any age.
Okay.
Who are concerned about their breasts.
I mean, are the patients getting older and older for breast surgery now as compared to 20 years ago?
Yeah, well, you could say yes. I mean, we still see the patients, you see the patients in their early 20s and 30s who want to enhance their breasts. Similarly, you have patients in their 20s and 30s who are horrified because their breasts are too large, which prevent them from doing some of the, activities they'd like to do. Or, even worse, their breasts developed asymmetrically. And so now they have one huge breast on one side and very small breast on the other, and they literally can't wear a bathing suit in Southern California because they look funny. And then you see patients after pregnancy where their breasts have tremendously changed, or after, weight gain and weight loss. And then unfortunately, you do see some patients who have developed breast cancer, and their breast has been ablated in one form or another, and they're coming to me for reconstruction.
Okay. Now, what about silicone or gel-filled versus, saline implants? I mean, do you have a preference over one?
Not that I do, but I present to the patient what the options are relative to silicone and saline, and there are a lot of misconceptions, I think.
Like what?
Regarding, well, there was a moratorium placed on the use of silicone gel implants in 1992, and that has scared a lot of patients. Now, the implants were placed back on the market in around 2006 for everybody.
So they're safe now today. I mean, that's not an issue.
They are considered, but many patients don't believe that.
Is that right? Really?
And so they're afraid.
Now, the gel-filled have a natural flesh feel.
They do.
Is that correct?
Yeah. If you place a saline implant and a silicone gel implant underneath a towel and have 100 people feel them and say, which one do you think feels more like a normal breast, 99.9% of the people are going to say the silicone gel feels more natural.
Okay.
But in many patients, you can't tell the difference because it's a function of how much tissue overlies the implant. And the more tissue the patient has in front of the implant, the less you're able to tell the difference. Okay. So in a very thin individual, in my judgment, they're not a good candidate for a saline implant. But someone that's slightly heavier, it might not make a difference.
Okay, now what about incisions? Do you have a, through the belly button?
The choice of incision, again, is part of the planning. Not every patient, in my judgment, is a candidate for every approach. And so consequently, there are some patients who I try to steer away from an approach because I feel it will compromise their final result. And that's been, in some respects, proven to me where I've had patients come in and want me to do a procedure through an axillary approach, which I happen to do a lot.
What's that, the armpit area?
Through the armpit. And I'll tell them I don't think they're a candidate for that approach. They will interpret that many times as meaning, well, he just can't do that
Doesn't do that way.
And go to someone else. And then that same patient...
Well, then set the record straight here.
Well, they'll come back to me after they've been done by someone else, and they're unhappy with their result. And they think the doctor did something wrong. And I said to them, the mistake was doing you through the axillary approach. And that's why I didn't want to do you that way.
Interesting.
And the same thing applies with the tuba approach, the belly button approach. Not everybody
You think that's gimmicky, by the way?
In some respects, yes. But for saline implants, it is an option.
So where you place the incision, whether it's in the fold, through the nipple area, through the armpit area, you're going to pick the one that's going to give them what? The most natural result? Is that what you're saying?
Correct.
Was that the...
I try to lead... I view myself as a patient advocate. I try to take my knowledge, my experience, and apply it to their individual problem and do for them what I would do for my daughter or for my wife or for my mother. Part of the problem is getting patients to believe you.
Okay.
Because they hear so much, they go on the internet.
Well, they come in now today, they already know, right?
Right. They
know
think
the size, they know everything.
Right, but they don't have any experience. They have a lot of knowledge and no experience. And it's
so you're stubborn that way? That means you don't want to let them make a mistake?
Correct. And many times I have patients come in who are seeking liposuction in place of good diet and exercise habits. And I'll tell them to go out and diet and exercise. Similarly, patients coming in for breast reductions when they're overweight. And I'll tell them, lose the weight first. You might not even need the breast reduction, or you'll just be coming in for a simple breast lift. So I am a physician. I care about the patient. I'm trying to do what's in their best interest. And sometimes part of the problem is getting them to listen to me.
All right. Okay. Now, your before and after photos. It's very interesting what you do. And I guess we have, LA's top doc when it comes to breast surgery. You do something unique. I mean, I guess you select certain patients and do somewhat of a makeover.
Right. Well, we offer patients the opportunity to become patient of the month after their makeover. And we have patients of all ages who have chosen that course. And then they go for a professional photo shoot. And then they're featured on our website.
Patient of the month. And they get to keep the photos?
They get to keep the photos and use them. Sure.
We've got to print these out and show these. Okay, so this is what it looks like.
Yeah, I think Kaylee would be what you would consider your typical breast augmentation mammoplasty patient, a young patient, a very attractive patient who's unhappy with her own breast development. She does a lot of modeling, and there's a pageant, individual and felt that she would enhance her career by enhancing her breast, and it took off.
Now, what do they say, by the way? Okay, so on the consult, and do you encourage they bring a partner if they have one?
It just so happens she came with her mother.
Okay.
And if they have a partner, absolutely try to get the partner in, and it's very interesting if they do have a partner to see the reaction of the partner, because many times the partner comes in steaming at the ears.
Really?
You can literally feel the angst. And his
right?
attitude is, why are you doing this? I love you the way you are.
Is that right?
You don't need to change for me.
No, but the guys, though, and maybe you can help men, understand that. I guess women still, like you say, we've talked off camera, they still want to look pretty. So to these guys that don't want the woman to have the procedure, okay, that are so anxious, what do you say to them?
I said to them, this is something that is going to make your wife feel better about herself. And when she feels better about herself, she's probably going to feel better about you.
What are their fears about? I mean, what do they ask? I mean, take me through a consult. Okay, so they come in. What do women want to know? Because it seems like they already know the answers about breast augmentation.
Yeah. Well, first of all, I have to educate them as to the benefits as well as the risks.
Okay.
And because many women have the misconception that they're going to come in, have this operation done, and never have to think about breast surgery again. When in point of fact, in the materials which they're given from the implant manufacturers, these are not meant to be, quote, permanent devices. And patients forget that they're going to age. And as they age or their lifestyle changes, their breasts are going to change just like the rest of their body is, and improvements may be needed down the line. Well, here's Alana, another patient that came in for a breast enhancement.
Okay.
Very pretty girl. Wanted to enhance her breasts. And we went ahead through an axillary approach and gave her a very attractive result.
That's through the armpit area?
Through the armpit. And I try to educate patients regarding size, because clearly, given the frame of an individual, as the implants get bigger, they get wider, they project more, and they have more of a, you could almost say, destructive effect upon the breast by just stretching the breast tissue and the overlying skin. And so, whereas the women usually want to go larger, I try to get them perhaps to be a little smaller, thinking of safety involved.
Okay.
All right. But ultimately, the patient makes a decision regarding size. But here's a patient, we did her surgery, liked her look, and then decided she wanted to go larger.
Okay.
I think she was wasn't getting as much attention to her chest as perhaps she had desired. And so she came back in, and through the axillary approach, we literally doubled her size. That's the same patient.
It's very nice. Well, that's good. Okay, so she comes back. She goes a little larger. Is that common, though? People 2, 3 years, 5 years come back later and
yes, and want to change size. It's very interesting. I say to women in their 20s and 30s, you want to go larger. Then when you hit your 40s and 50s, you want to go smaller.
And that's very common.
Yeah, but also associated with it, usually they are gaining weight, so their breasts may increase in size over the years, and so now their breasts are larger, and becoming more difficult for them to perhaps wear the clothes they'd like to wear, and so they now want to go smaller. So
are there women that are really, really ashamed of their breasts?
Oh,
they confide in you?
Absolutely, because they're, besides the fact that they may be larger than they want to be or smaller than they want to be, there are women that are born with congenital deformities of their chest and literally will not even let their parents see what they look like, mothers see what they look like and won't let a man touch them.
Is that common?
I won't say it's common, but I have patients like that, and one of those patients, it was photos I didn't bring today, actually became a Playboy playmate who was born with bilateral breast deformities. What
about lifts? After pregnancy, lifts, what about the incisions?
Well, again...
is there anything new there in the last 20 years?
Well, in the last 20 years, absolutely. There are a lot of different types of lifts. Within the last 10 years, there's the vertical lift, so that, previously when one thought of a large lift on someone, one thought of the old anchor scar, an incision around the nipple-areolar, a T-looking,
okay,
big anchor. And obviously the scarring from that was very objectionable to a lot of women. And subsequently there have been procedures developed to minimize the type of scarring. Sometimes one can do it just through an incision along the top of the areolar border called a crescent. And then one can do it with an incision all the way around the nipple-areolar complex, a circumareolar mastopexy, or now varying types of circumvertical mastopexy, so what the public likes to call a lollipop incision.
So do you like breast lifting? The lifts?
Yes. Well, it's not a question
more challenging to you?
They are more challenging because it's a lot of it is art, which approach you use and getting the results. So it's not a cookie cutter approach. It's
a trickier procedure, more technically demanding?
Yes.
A breast lift?
Yes.
Now, are you doing a combination of procedures on many of these patients, like a mommy makeover after pregnancy? They need a lift. Are they doing multiple procedures?
Frequently, you have women come in whose breasts and abdomen have been affected by pregnancy or weight gain or weight loss. And we do the breast procedure and the abdominal procedure simultaneously. Of course, taking into account what the patient's health is like and determining thereby whether it should be done as separate procedures or it can be done all at once.
Okay.
You know, I'll see patients, massive weight loss patients with health problems, and my feeling is for major trunk lifts and that, they should be done in the hospital for their own safety.
Okay, so your surgeries right now, by the way, are all done where you are?
I have a surgery center in my office in Orange County, and we do the procedures there, but those patients who I feel need to be hospitalized, and we go ahead and do them in the hospital.
Okay, good. We're going to take a quick break. When we come back, more photos and some of the older patients you have that have breast surgery. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about breast surgery, what you need to know. You don't want to miss this next segment. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about what you need to know about breast surgery. If you're considering any type of breast surgery, you have to hear what my guest has to say. He's very well-known offices in Beverly Hills and Orange County, California, and he is known as the breast guy, amongst other things, right? I mean, you do faces and you do tummy tucks and everything else. But your website, thebreastexpert.com, also, and this is a real interview. I mean, I'm not endorsing you on this show, but your website is very unique.
Thank you.
You take patients and then you do these like makeover kind of glamour photos that are very sexy, by the way. Very, very good. Okay, so you were talking about self-esteem.
Right.
That many people have hated their breasts for many years.
Right. Here, and Lisa is a good example of that type patient.
Okay.
Lisa underwent a mastectomy for breast cancer and then began the process of breast reconstruction with another doctor. And the result that he obtained left the patient horrified and literally afraid to go to the beach, go swimming, wear a bikini.
Okay.
And she thought that that's the way she was going to have to live for the rest of her life. She was referred to me, and
who refers her to you, by the way?
Usually it's other patients.
Okay.
Or she may have found the website and came to me. I told her I felt we could help her, and we reconstructed her breasts, and she became patient of the month. She's a beautiful woman.
Very pretty.
And very proud of her figure.
So when you're on the consult and you look at a woman and there was a problem elsewhere, in your mind, do you see the end result? Do you think, wow? I mean, do you know exactly where this person went wrong in the last surgery and where you could turn it around?
Sometimes yes, sometimes no.
Okay.
But clearly you have to look at what the defect is and think in your mind, how can I correct it? And I've had patients with complications from augmentation mammoplasties who have required extensive reconstructive procedures. But the good thing to know is that it can be fixed. And that if there are problems, and I literally, relative to the breast, I don't care what it is, we can make you whole again.
Okay, good. So after cancer treatment, and how do women, after a mastectomy, how do they pick their doctor? Just whoever the
Well, many times now it's based upon who their insurance carrier is.
Okay.
You know, unfortunately. But those patients that have very good insurance or have some money will seek a doctor. And I've treated patients literally from all over the United States and all over the world specifically for breast reconstruction. Matter of fact, most recently we had a patient fly in from North Carolina who had her mastectomy done there and then flew
Well, good for
out.
you. Just because they know you for results. So do you want to be known for your results?
Oh, I think every plastic surgeon does.
Okay. All right. Now you have more photos, and we're just about out of time. What are we looking at over here?
Well, here's another success along the same line. Here's a girl that lost 100 pounds and was horrified.
You're kidding me. 100 pounds.
She lost
Looks
100.
like a professional model right there.
Right. And she was working in the back storage of a wine cellar. Didn't want to go out and and after her surgeries, she's now an exotic dancer in Vegas.
Okay.
And you can see why looking at the photos.
So, lost 100 pounds, goes to you. Did you do other things too, or just her breasts?
We did other things.
Okay. All right. All right. Well,
and made her feel infinitely better about herself.
Now, but is she like a lot of people that their body or their self-image just completely
changes,
holds them back in life?
Absolutely. Because, and it holds them back in relationships or even getting involved in a relationship. And then once they have the surgery, they feel better about themselves and their life opens up.
Are you ever surprised at the transformations that you see when it's all done?
By the surgery or the transformation in the patient?
in them.
Oh, yes. I mean, there are people that go forward and do things, you know, and it makes me feel good about myself.
But, you know, I was talking to your wife that was in studio, helps you run your practice. And she says that a lot of the women have a tough time dealing with all the compliments they get.
No, it's absolutely.
That's hard to believe.
I know it, but it's true.
Did they tell you that too?
Yeah, because in some respects, patients can't trust that attention. They're not used to having eyes focused on them, let's say when they walk along a pool or walk into a club, and now all of a sudden they're getting loads of attention, and it can be frightening.
Do they say that? You know, people are asking me out. They're
Absolutely. The other day, I just had a patient tell us she's a court reporter in the courtroom a lot. Never was noticed before. Now, she goes in and all eyes focus on her when she walks into the courtroom. She's being asked out by lawyers who basically ignored her in the past.
Is that right? Okay, so this last patient, you have one chance. This is great. I like this one because.
And this, in some respects, is your older patient comes in, been taking care of her parents who are older,
approximately
50s.
50s, okay.
And comes in is unhappy about the appearance of her body, and for the first time wants to do something for herself, and decides that she wants to go ahead and have a facelift and breast lift augmentation. And very happy, and her husband very supportive, and now she's, is a fitness guru.
Is that right? She looks like $1 million. So you did the face. Does. Very natural, by the way.
Thank you.
Looks good. And now, do you think people put things off too long? That means that do they confide in you? Obviously, you know, the public, especially men, we don't hear about all these insecurities like you hear on a daily basis. Well, but the people say, I've been miserable for 10, 20 years? Or?
Yeah, many patients who have put off doing things because they felt were other obligations to their family or to their children. And now they have the opportunity, I want to do something for myself. I've heard that once, I've heard it 1,000 times.
Is that right? They say that a lot.
And then they go and do a complete mommy makeover or daddy makeover.
Now, and we're out of time, but you do male breast as well?
I do.
A lot of technique I hear there.
Yes, I do. And again, judgment is involved. But yes, I see men who are troubled by man boobs and come in to have them removed. Similarly, I have transgender patients, female to male, who are unhappy with their breast and also want to remove their breast as seamlessly and scarlessly as possible.
Okay, good. Final message, by the way, we're out of time. Somebody watching this, they're not happy with their breast or any part. I mean, you're a plastic surgeon. What do you say to them?
There definitely is hope. And I think that they need to seek out an expert in the field. They want to go to my website or make an appointment with us. we can help them. And there are many techniques that were not available previously, like we mentioned capsular contracture. You do not have to live with capsular contracture.
That's a hardened breast, is that correct?
It's a hardened breast from scar around it. It can be corrected reliably.
And as far as techniques, I mean, would you say that you're using or in the know of all the new stuff that's out there?
Absolutely. You asked about my education, and obviously I have very good training. But in point of fact, I don't do anything today like I was trained to do, because times have changed, techniques have changed, instrumentation has changed, even the implants have changed. So things are better, and I think those physicians who are getting the best results are those that have, so to speak, changed with the times and kept up with what's going on.
Well, thank you for coming on the show. Interesting stuff. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Just put in Dr. Corbin, and we'll give you a copy of this. It'll be on your website as well.
Yes.
This tape. Look at the
websites.
Look at this. Look at this. Go to thebreastexpert.com. Very interesting website. Probably none other like it that I've ever seen.
Thank you.
And I guess if you're not happy with your breasts, you can do something about it. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.